Imagine this. A patient looks at you and says,
Promise me you won't tell anyone what I'm about to say.
what would you do? Would you promise? Would you keep that secret no matter what? Or are there times when you have a professional duty to share confidential information? This is one of the most challenging situations nurses can face. Today we're discussing patient confidentiality, when it must always be protected, and the limited situations where information may need to be shared. If you're a nursing student, newly qualified nurse, healthcare assistant, or experienced nurse, this is a topic that affects every shift you work. Let's get started. Patient confidentiality means protecting information that patients trust us with. Patients tell us things they may never tell anyone else. Their medical history, their mental health, their medications, their diagnoses, their family circumstances. Without trust, patients may stop sharing important information. That could affect diagnosis, treatment, and ultimately patient safety. Confidentiality isn't just an ethical principle. It's also a professional responsibility. Every conversation, every document, every computer screen, every phone call, every social media post matters. Many people think confidentiality is only about names. It isn't. Confidential information can include the patient's address, their age, their diagnosis, their hospital room, photographs, blood test results, medical records, and appointments. Imagine saying, I looked after the mayor today. You never mention a name. But many people now know exactly who you're talking about. That's why confidentiality goes far beyond simply removing someone's name. Section 3. Common confidentiality mistakes. Two nurses are discussing a patient in the hospital lift. They assume nobody is listening, but standing behind them is the patient's daughter. She immediately realizes a private clinical discussion has become public. After work, two colleagues meet for coffee. They begin discussing an unusual patient they cared for. That patient we had today was so unusual.
I know, right? We should follow up.
Again, confidentiality has been compromised. Let's look at a scenario from social media. A nurse posts, I can't believe the case I saw tonight. No names, no photos, but enough details for local people to identify the patient. The post spreads quickly. This is why healthcare professionals must think carefully before sharing workplace stories online. This is the question nurses ask most often. Can confidential information ever be shared without the patient's permission? The answer is sometimes. Examples may include sharing information with members of the healthcare team directly involved in the patient's care, responding to certain legal requirements, safeguarding concerns involving children or vulnerable adults, situations where disclosure is necessary to reduce a serious risk of harm. But here's the important rule. Only share information when is a legitimate reason. Only share what is necessary with the appropriate person, and always follow your organization's policies. If you're unsure, stop. Speak to your senior nurse, safeguarding lead, manager, or another appropriate senior clinician. Never guess. One of the most important principles in healthcare is this: only share the information that is needed. Imagine a doctor needs to know a patient's allergy history. Do they also need to know unrelated personal information? Probably not. Share only what is relevant. This helps protect patient privacy while supporting safe care. Here are my top 10 confidentiality tips. Number 1, never discuss patients in public places. Number 2, lock your computer whenever you walk away. Number 3, keep patient records secure. Number 4, be careful with phone conversations. Number 5, think before sending emails or messages. Number 6, never access records unless you have a legitimate work reason. Number 7, be cautious with social media. Number 8, double check who you're speaking to before sharing information. Number 9, if in doubt, ask for advice. And finally, remember that confidentiality continues after your shift ends. Confidentiality isn't about keeping secrets. It's about protecting trust. Every patient deserves dignity, respect, privacy. As nurses, we're privileged to care for people during some of the most vulnerable moments of their lives. Protecting their information is part of protecting them. And remember, there are rare occasions when sharing information is the safest and most appropriate thing to do, but those decisions should always be made carefully, professionally, and in line with the law and your workplace policies. Protect the patient, protect yourself, protect the profession. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more practical nursing education from NurseIQ. I'd love to hear from you in the comments.